I wanted to talk about healthcare insurance and how confusing it can be, and who better to talk to about this topic than Rick Ungar. He is the senior political contributor for Forbes, where he also talks very often about healthcare, and he is the co-host of Steele Ungar on Sirius XM POTUS Radio every night at 6 p.m. Eastern.
Right.
Rick, thank you so much for being here.
Pleasure to do it, Heather.
So let's talk a little bit about healthcare, about why people are so much up in arms about it right now.
Well, I mean, a lot of why people are up in arms has nothing to do with reality, interestingly. The communications battle, going back to the very beginning, has really captured everybody's imagination, and frankly, the opponents of Obamacare did a much better job in selling their point of view. Most people, they certainly understand certain aspects of it as it pertains to them, but there's so much of the bill that they never knew was there. All of the trial and error experiments that were included in the bill to try not to lower your prices necessarily in terms of your insurance premiums, but to try and find better ways to deliver health care at a better price. We're starting to see some of those results. Some have been interesting, some not so good. And that's what you can expect. The insurance problem is what captures people's imagination. And look, I mean, there's political issues there. I've always thought that the president made a mistake when he suggested that your prices would go lower and
Right.
You could keep your doctor.
Right, you're supposed to undersell, right, and over-deliver?
And not only that, I mean, I spoke to the White House the day he said that, and so what are you doing? The reality is, long before anybody ever heard of Obamacare, very rarely did anybody keep an individual health insurance policy longer than 2 years. So already people were not staying on the same policy. They couldn't really keep their policy even if they wanted to, because insurers would constantly revamp it, revamp who they would sell it to, et cetera. So that was troublesome. And if you're not going to keep the same insurance policy, odds are you may not have the same choice of physicians.
But we're talking about two different things here, and I want to get back to the trial and error part of it. But first, I want to talk about the insurance part. You know, recent news has it that 40% more people are insured now that we have Obamacare. Right. So if you look at that, what's the problem? Why isn't this something to celebrate?
The problem is that strata of people who make too much money to qualify for government subsidies. The government subsidies obviously keep the prices down for those who get them. And then you have a large percentage of Americans who get their insurance through their employment. But those people in the middle, they're the ones who are having a hard time, because a lot of them don't make a lot of money, and they're the ones who have to pay these increases in premiums out of pocket. They're the ones getting hurt. They're the ones Bill Clinton was referring to, quite truthfully, although maybe politically not at the right time.
Now, do you think that as more and more people buy in, we're going to have an issue where there's just not enough care to go around? I know that that's something that, especially when you've got more sick people being insured.
So far, that hasn't been, I think, as big of a problem as many people thought it would be. The bigger problem is happening in the insurance pool, because people who were having trouble getting insurance before because they had a pre-existing condition, the sicker people, they're flocking to it.
Right, of course.
And if you look at the numbers, so much of the increase in insurance coverage is coming from those who had trouble getting it before, and the growth in Medicaid through the Medicaid part of the bill. That's where a lot of it is. I don't know that you can solve the insurance pool problem, given how many more people who are sick have come into it. You may have to look at some new ideas, and I think that's really what's flushing out some of the competition, some of the insurance providers.
On one side of the political aisle, they talk about a public option. On the other side, they talk about repealing the whole thing and trying to start over somehow. What do you think is the best solution for this problem?
Well, I've always been a big fan of Medicare for all. Not that you have to take it. You know, I think you should have that option. If you want to have Medicare, great, you can get Medicare. Everybody's entitled. If you want to go a different way and get private insurance, great, do that. But that's not going to happen. So I've really been much more in favor of testing a lowering of the age of Medicare, because there's a logic to it that I don't know why people don't instantly see it. Right now, I'm 65. I am the healthy person in the Medicare pool, right? I'm the youngest one there. That's troublesome. At 65, you've got health issues that cost money. If you lowered that age to 50, you'd be bringing in millions of people, if they want to elect to take it, who are indeed healthier. So now you've really you've advantaged the insurance pool in Medicare. And for those people who say, well, the problem is now you're spending more of my tax money on that, not necessarily, because you're going to be getting a higher premium for the lower age people.
Right.
Than you get in Medicare, and they're far less likely to use it. They're not going to be
They're
as
not
sick.
going to have as many issues.
On the other side of the fence, you've now lowered the private insurance pool's age from 65 to 50. That's huge.
Right.
That's huge. You have just greatly strengthened the insurance pool there.
Now, why am I not hearing this from any of the politicians? It doesn't seem like something that's been bandied about.
You know, my partner, Michael Steele, who is not a proponent of Obamacare, whenever I bring it up, he just immediately shuts down on it. And there is a lack of willingness, I think, on people who opposed Obamacare to like this, because all they see is more taxpayer money being spent.
But isn't that a necessary evil at this point?
It depends what your philosophy is. I think it is. I mean, this really does go back to the fact that this is the only industrialized country on the planet that does not view health care as a right. We view it as a privilege. Some people are fine with that. Some people don't think it should be that way. If you view it as a right, which I think a country as rich as ours should, it changes everything, because now you have an obligation to make sure everybody at least has a certain level of basic coverage.
Isn't the horse sort of out of the barn? Can you really, I mean, I know that, Donald Trump is talking about repealing Obamacare. Can you really take back the benefits? You've been a lawyer.
You can take them back. Congress can legislate them out of existence. You're not going to have a very happy public, because while, we all hear all the people screaming about Obamacare, what you don't hear much of are the people who are happy about it. And that's problematic. They could never, I think that even the staunchest opponent to that program would tell you we couldn't take back everything. We couldn't take back the opportunity to keep your kids on your insurance till you're 26. We probably couldn't take back coverage for everybody, even those with pre-existing conditions. But what they can never answer is the question, okay, if you agree you're not going to take that back, do you want to tell me how you're going to cover them if you don't have the penalties and you don't have the mandates? In all of our existence, nobody has ever been able to figure out how to cover people with pre-existing conditions in an insurance pool if you don't force younger, healthier people into that pool. So their ideology is sadly at odds with the realities. You've either got to say, all right, too bad for people who are more likely to get sick, their fault, or you have to accept that mandates are necessary.
One of the points that I want to get back to is the part of Obamacare that people don't talk about so much, and that's the trial and error portion of it. Tell me a little bit about this, but also how it will be impacted by this election and what happens depending on who wins.
Well, I mean, there are any number of things being experimented with. The one that I think always thought was the most interesting, the effort to reduce recidivism back to hospitals. People had no idea how many patients, particularly elderly.
So you're talking about readmissions, people going back into the hospital.
Yes, they would be released from the hospital, they'd go home, and within 2 weeks they'd be back. Why? Because they didn't get proper instructions for their medications. They didn't do the follow-up with their doctors, because people are cranky and hate doctors. They don't like to go to the doctor.
And they don't understand all the time.
Right. So basically the law made it very difficult for the hospital. If that person comes back within 30 days, you're not getting paid the way you did for that first admission. And that motivates doctors and hospitals to do a better job. And that's had some benefit.
Yeah, and I think it will continue to have some benefit. I think, too, patients need to understand that that happens. I think that it's the same thing when you're sitting in an airport and you know the reason for the delay, you're more likely to be happy. If people know you're more likely to be readmitted to the hospital, pay attention to this. Yeah. I think that we need to give the public a little bit of credit in that respect.
I think that's true. But, one of the failings that I thought came with Obamacare, I didn't feel there was enough included to promote the pushing forward of medicine. If you allow a person to see their doctor and visit their doctor online, You're saving great time for the physician, which allows that doctor to see more patients and make a better living. And you're saving the patient from having to go out of the house and go do it.
Which costs the patient out of pocket about
Sure.
$46 per visit,
Sure,
according to a
right.
recent Harvard study. So that seems to be a no-brainer. I didn't realize, because I do think that that's a big part of the
It
future
is.
of medicine, to
It
have
is.
the ability.
The other part of that, though, the things that we need to do, this is available now. You can get all of those tools. When you go see your doctor, they tap your knee, they put a lot, the throat thing there. You can have all of that in your home, connected online, electronically, for not that much money. People tend not to go buy those things. They see that as not a necessity. I have been a long-time proponent of, look, when we build a house, there are city ordinances that require you to do certain things in order to make sure the house is safe for you to live in. Why not build those systems into a wall in every new home?
Well, I mean, that's a little Jetsons, but it does seem like it's going to be the
actually not.
future. No, I agree. I think
It's
that's
actually not, no.
that is definitely the future of medicine, and especially for the rural areas
Yes.
where they can't get to doctors or get to good doctors. I think that there's always been a fear of, are you going to get the same exam? But I think that with technology, that is going to be possible.
You absolutely can get the same. And look, there are going to be things that are going to happen where the doctor's going to say, you know what, I need to see you.
Right.
Come on in.
But that's not every visit.
But most people, that won't be the case.
You are one of the most optimistic people I know. Do you have optimism about the fate of Obamacare, and do you think that eventually will history show it to be a good law?
Interesting question. It'll be shown to be a good law if Congress comes around to understanding this is not a political fight. You've got a wife, you've got a husband, you've got parents, you've got kids. Stop thinking about this politically and start thinking about this as how we make a healthcare system that works. Until they get there, if they continue to make this about winning and losing on Obamacare, then we're all going to lose. Obamacare is a beginning. And you can argue about would there have been a better beginning, but we had to have a re-beginning. We did. Otherwise, we were on a crash course. We may still be on a crash course. And how this all works out will answer your question. I don't know. I do know that if it does crash, and it may, we'll rebuild it.
Rick, thank you so much for your time.
Pleasure.
I appreciate
Pleasure.
it.